Thank you, Dick. If any of you know Dick Jackson's career, that's about the most incredible honor to be introduced by Dick Jackson, who is one of our nation's key leaders in environmental health, and his leadership at CDC and onward before that and after that has been an inspiration to many of us and definitely an inspiration to me. So thank you very much. And I really want to thank Catherine and the leadership at PSR for this incredible conference, so well planned. You know, this is the Pope, the reason the Pope is here. His scheduler messed up a little bit, but I think that he was going to be at this conference. But if any of you have not seen the Pope's encyclical on environmental stewardship, it's required reading and is so critical to delivering the messages that we've been delivering, that in fact you can't have healthy people on a sick planet, and that his voice is incredible to add on to what PSR has been pushing for a long time. Another bit of news is that just a couple weeks ago on the cover of The New Yorker magazine was a title that said Climate Change, the Golden Opportunity. Don't quote me, but something about the positive message of climate change. Climate change is a real opportunity. And so my presentation is about climate change health risks, but also how climate change policy could be the greatest opportunity in health that we've had in over a century. So the title of my talk, Climate Change Policy's Silver Lining for Public Health. This is a graph all of you have seen. You can see that most of the world's best climate centers are all in agreement about the warming we've had over the last century. And many people that argue that, you know, climate is always changing, and isn't this just, you know, part of something like that. You can see on the bottom graph are sunspot cycles, and you can see that the blue line that indicates the warming that we've had has no relationship to sunspot cycles. And so this is just one reason why 97% of climate scientists that have been surveyed agree that today's heating of the Earth is human caused. And that's a key message, a very key message that the Intergovernmental Panel on Climate Change, the IPCC, has been giving with even stronger certainty for every report that's come out. So what are the projections for climate change? Well, according to the latest UN IPCC report, these are representative concentration pathways, or RCPs, as far as greenhouse gas emissions. And you can see the range here from about 1 degree centigrade to 7 degrees centigrade. And unfortunately, right now, the way we're consuming energy, we are on the pathway to the right, the red hot pathway, unless we do something very quickly to reduce our emissions. And most of our emissions have been recently, you know, since 1988, more than half of CO2 emissions have been released. So, you know, this is something that is accelerating, and especially in the last few decades. And if it's that relatively new of a problem, then I think that there should be a ready solution more at hand. Now, if any of you know me, I've been doing this for a long time, as Dick said, and this slide goes way back to 1988, and it's only changed a little bit, but basically, this should not be any news to any of you. It's to show that these physical attributes of climate change, temperature rise, sea level rise, and extremes of the hydrologic cycle, will affect health through many pathways, from heat waves to air pollution to infectious diseases, especially those carried by insects or rodents, like vector-borne diseases. And because it's more than just temperature issues, it's also extremes in the hydrologic cycle, more droughts, more flooding, that can affect waterborne diseases and our food supply. Now, at the bottom, I say, there's mental health and environmental refugees. And this is an issue that I think Dick Jackson once said could be the iceberg under the tip of the iceberg, and I fully agree with him that this issue of forced population displacement and environmental refugees could be enormous, could swamp these other ones. But as you can see, there are many ways that climate change affects health. And it's for this reason that I've actually dedicated my career to looking at this issue, because personally I think this is the greatest public health threat we've ever faced. So let me just give a couple examples about temperature increase. This is also known to all of you, the severe heat wave that hit Europe. It's estimated that between 45 to 70,000 people died in 11 days. That is a public health disaster. And this was a very rare event. This was a 1 in 500 year event. But the climatologists that have looked at these extreme heat waves in Europe and in Russia say that already the greenhouse gas emissions in the air that we've already emitted double the likelihood of us having these heat waves. And if you go into the future, by mid-century, this extreme heat wave could increase by 5 to 10-fold, according to the climate scientists, looking at the frequency of extreme events. So if you think about a natural bell curve of temperature, if you shift the average by 1 standard deviation, and you look at let's look at the right-hand tail, the little blue tail on the bottom there, that's the hot temperatures. If you shift by 1 standard deviation, the extremes increase quite a bit. So a 1 in 40-year likelihood event turns into a 1 in 6-year event. So 1 in 40-year likelihood heat wave may happen every 6 years. And this is what we're worried about in public health as far as dealing with these extreme events. This is the signature of climate change, according to climatologists. It's the increased extreme events rather than just the mercury gradually creeping up. This is the concern that we have. Now, we've done some studies looking at what would this mean in the United States, and we've looked at many cities, and right now, if you look at New York City, New York has some hot days in the summertime. Right now, there are, on average, 13 days that are 90 degrees or 32 degrees centigrade, 90 degrees Fahrenheit or warmer, 13 days right now. But by mid-century, by 2050, the year 2050 or so, this average of 13 days of 90 degrees or hotter in New York triples from 13 to 39. So in 40 years, New York could have 3 times as many extremely hot days as it has today. And our analysis is consistent with many others. This is quite concerning. The other issue with hot temperatures is that if you look around the world, there have been models of climate published in the journal Science showing that every place in the world here that you see will have temperatures hotter than ever recorded in their history. The top map is mid-century, so the year 2050 on average. It's actually 2040 to 2060. You can see everything in orange or red has a 70% probability of having the hottest summer ever in their history. The map on the bottom is from the end of the century, so from the year 2090 to 2100. So by century's end, everything in red that you see has a 90% probability of having the hottest ever temperatures that they've ever seen. Now, one major concern for public health, when you think about growing food and crops that are being grown in a narrow climate envelope, and in the tropics especially, if you push the envelope a little bit higher, the temperature is higher, you could have crop failures. crop modelers took this analysis, and they estimate that by the middle of the century, today's number of people at risk of hunger, which is about 900 million people at risk of hunger today, that number could double because of extreme temperature effects on crops. This is a very significant public health risk. Now, there are some people that argue that global warming's greatest threat may also be the smallest. And of course, what we're thinking about are insect-borne diseases. And we all know that insects are cold-blooded, unlike us. And when the temperature changes a little bit, their body temperature changes with it. Whatever the air temperature is, that's the body temperature of a mosquito. And if that mosquito is carrying malaria parasites or West Nile virus particles, the development rate and the transmission dynamics of these insect-borne diseases depends on temperature. And we've seen models where you take a place like Zimbabwe, Africa, where in the center of this slide you can see that line of cooler colors, the greens, the blues, right in the middle. Those are the highlands where the main cities in Zimbabwe are. And if right now this is showing a climate suitability map for malaria. The warmer the temperatures, the faster the malaria parasite develops in the mosquito. And so this shows you that at high altitude, where it's cooler, there's less transmission of malaria. But let's roll the clock forward a few years. According to climatologists, by the year 2050, those highlands will warm up and you'll have much more likelihood of malaria transmission. So we're worried that some diseases will change in their geography or their transmission period. Now, of course, climate change is not just about temperature. It's also extremes in the hydrologic cycle, more floods, more droughts, changes in the pattern of precipitation. And so, we don't really know the best term. I think when Mona and her group talk about communicating climate change, it's not right to call it global warming. It's not just warming. Climate change, we think, is probably not the right word either, even though scientifically it's more comprehensive. Right now, I think I wonder, Mona, if we're settling on the global climate crisis. But anyway, it's not just global warming. It's also about flooding and droughts. And if you look at models from the U.S. Climate Change Research Program, looking at the nature of precipitation, not the amount, but we're talking about heavy rainfall or light drizzle. And on the right side of this graph, those are heavy rainfall events. When it rains more than 2 inches per day, really, heavy rainfall. When it rains, it will pour. Well, this is what is expected according to climatologists. When it rains, it will pour, and when it doesn't rain, it will really be an extreme drought. It's all about extremes of the hydrologic cycle. So what does this mean for our health? Well, if you live around Washington, D.C., how many of you are from Washington or the Washington area? And how many of you have gotten sick after a heavy rainfall? Well, you don't have to raise your hand, because I can tell you that, even around Washington, we have these combined sewage overflow events. This is no news. Dick's group and EPA have been talking about this for a long time. There are many communities that combine stormwater runoff and sewage, and it's simply, an investment that has to happen. But when it rains hard, our water gets contaminated in many times. And in fact, we've done some modeling and found that the Chicago area, by mid-century, because of this increase in the heavy rainfall events, could have a doubling or a 100% increase in their combined sewage overflow events by the middle of the century. So here's another issue that we're concerned about in public health, the safety of our water. We have come a long way in the last 20 years on climate change. And this year, this is a critical year. You all know that the 21st Conference of the Parties of the United Nations Framework Convention on Climate Change is taking place this December in Paris. And that's when we are going to negotiate legal binding commitments. In preparation for that meeting, the Lima Conference of the Parties on Climate Change met and have come up with a requirement for every country to put down intended nationally determined contributions to reduce greenhouse gas emissions. And these are beginning to come in now in advance of the December meeting in Paris. And you can see across the board, that countries are starting to put down their commitments. You can see Japan, Australia. The United States commitment was 26 to 28% reduction below 2005 emission levels in the next 15 years, but Obama has upped that now to 32%. I think our administration on this needs some applause. Now, I did my sabbatical last year in Ethiopia, and you can see at the bottom there, Ethiopia has pledged a 64% reduction compared to business as usual emissions. And I think that even though their contribution on the global front, their attributable contribution is very small, but their leadership and committing to 64% reduction is incredible. And I was there when the U.S. ambassador co-signed with the Ethiopian Minister of Environment saying the U.S. is committed to do whatever they can and increase the Power Africa funding from USAID. And so I think this is something where it's really impressive. Now, you look at these numbers, they're not necessarily high enough. And you look at these numbers and they're quite daunting. You say, oh my gosh, how are we going to get down to these levels? How can we get off of fossil fuels? And this is where I think if you think about the public health issue and linked to climate change, this is where I would say that the policy to combat climate change might be cost-free, and especially public health co-benefits, when added into the equation, could make climate change a net gain. Now, if you look at the work from Alan Lockwood about, if we can get off of coal emissions, which is killing many people, it's estimated that 8 million people die prematurely from air pollution every year. If you look at cardiovascular risks and our diet, I know Bob Lawrence and others will be talking about why we need to get more on a less of a meat diet. It's good for the environment and it's good for our health. And finally, regarding another threat, when you think about the rates of chronic disease, obesity, diabetes in this country, a new estimate has come out from WHO on the global burden of disease, and that is that more than 3 million people die prematurely because of our sedentary lifestyles, much of that tied around the automobile. So getting to low carbon and getting off of fossil fuels, looking at these three issues could be enormous public health benefits. So let's look at a benefit from energy policy. So again, as I mentioned, Alan Lockwood's work and others show that outdoor air pollution kills 3.7 million people every year. And of course, there's the indoor air pollution issue when you're cooking with coal or wood, and the indoor air pollution work that Kirk Smith has been working on and other people. That kills more than 4 million people every year. So getting to renewable energy will save lives through improved air quality. There was a study done recently showing that if you looked at the reduction of greenhouse gas emissions through various different ways to get there, that the parallel reduction in particulate air pollution would be a significant public health gain. And you look at places like India, China, where you could have, you could save 800,000 lives every year through greenhouse gas emission reductions, because at the same time you'll have less PM 2.5. So you could save up to 4.7 million lives every year from greenhouse gas emissions reductions. I want to wrap up this part, and I'm almost done. Don't worry, Dick. And take a policy look. And what are the politicians and economists asking? You know, what would it take to get to a green economy, to reduce our emissions, to reduce CO2 in the atmosphere, to prevent climate change? Well, according to economists, it might cost up to $30 for every ton of CO2 that you get out of the air, that you reduce you make cleaner energy. It might cost $30 per ton. But for every ton of CO2 that you avoid emitting, you also reduce emissions of conventional air pollutants. So much so that the benefit of cleaner air, on average, would be $200 for every ton of CO2 that you don't emit. So this could be the hardest question you've ever had. Which number is bigger, 30 or 200? And this is where you as health leaders need to get this message out, that if you're talking about, you know, the expense of cleaner energy versus the huge health benefit, only the one side, the $30, is the only thing in the policy arena that people are thinking about. They're not even thinking about the larger side of this equation, the public health benefits. And in many places around the world, it would be even larger than $200. This was a really important recent report out of MIT showing that if you look at reducing emissions of carbon, in the United States, the health benefits could offset the cost of clean energy somewhere between 26 to 1,050%. In other words, the health benefits would be somewhere in the range of offsetting the cost of clean energy by a quarter to tenfold. Again, this is a key message to get out to policymakers. There are co-benefits from agricultural policies, and Bob Lawrence and that group talking about food will get more into this. And this is from the People's Climate March that I had the honor of marching with my mother when this occurred in September of 2014. Mom, do you want to raise your hand for a second? Yeah. So we walked for, I think, 3.5 hours. Of course, my sister is sitting next to her, and she's the one that got me into this field of environmental health to begin with. So anyway, you know, if you read the little logo, little sign there, I am full of greenhouse gases. Do you have a stake in it? Of course, you know, our diet is tied into energy consumption and environment and our health. And if you look at, you know, diet versus greenhouse gas emissions, you can see on the left, a meat diet requires far more energy to produce that kilogram of protein compared to fish or vegetarian or vegan diets. If meat consumption were halved in the UK, greenhouse gases would be reduced, but also saturated fats would fall and heart disease would be reduced. So these are obvious connections. Finally, there are co-benefits from transportation policies, and I think that this is probably one of our most direct health benefits from a green economy. You know, look at how we've designed our neighborhoods. Dick, this is probably one of your slides, I think, because Dick Jackson is a major leader on health in the built environment, so I'm sure this is one of your slides. But we've designed neighborhoods for cars and not for people. This is a problem, and this is not health promoting. And if you look at the opportunity from active transport, you know, getting around on foot or by bicycle, 80% of Americans do not meet the recommended levels of aerobic and muscle strengthening exercise. That's incredible. And according to the Department of Transportation, a lot of trips, 40% of trips, are less than 3 kilometers. That's a really short trip. So we did a study, and we asked the question, what would happen if you, in the Midwest region, if you converted short car trips, less than 5 miles round trip, to bicycle trips? And you did it just for half of the time and only in the summertime. And we have models of transportation and air quality, and we look at that over populations and basically look at air pollution reduction. The second part of this is, what about the physical fitness? You know, assume that half of these short trips done by bicycle in the summertime, you know, what about the physical fitness benefit? And so we found that we'd save more than 1,000 lives every year from switching over to active transport by biking. This has been replicated in other places. You know, more bikeability, you know, you see a reduction in colon cancer, breast cancer, less heart disease, and really a low carbon economy can make us healthier and save money at the same time. So we're here at this wonderful place in time where we have a golden opportunity to seize the moment to really change our society. And for those of you communicating this issue, there are, of course, in the United States, many climate change skeptics. But even for them, you know, you can say, okay, let's not worry about climate. Climate change is real, it's serious, but let's not talk about climate change. What are the policies that we need to put in place to combat climate change? These are policies that we need to do anyway. We need to get to healthier cities, to cleaner air quality, to reduce meat in the diet. You know, these are things we should do anyway. These are no regrets policies. So this year is critical because in December, just a few months away, is the UN Conference of the Parties to establish binding agreements ambitious enough to limit global warming to 2 degrees centigrade. And according to climatologists, this is going to take some major reductions in emissions. So stay tuned and be, you know, looking towards influencing your policymakers, your representatives, because this is a critical time right now. We only have a few months to go before the big meeting in Paris. Dick was nice enough to hold up this book that Barry Levy and I have just released from Oxford University Press. We tried to make this the most readable book that you could have on climate change. We're calling this the core curriculum. And there are flyers in the back, and maybe someone from Oxford University Press is here. But also, this book will be the reading for one of these massive open online courses. And so in November, we're going to be running a course, one of these MOOC courses that you can all sign up for. So thank you very much for your attention.